Thank you for joining us. Things have evolved very quickly in the situation with the safety of our schools. Yesterday, we were given the authority to our local health department to make decisions on delaying school openings. Dr. Phil Huang serves not only as the director of Dallas County Health and Human Services, but also as the health authority for the county. He is the health authority also for all the cities, the city of Dallas and all the other cities, with the exception of Garland and Richardson, who have their own health authorities, but who are going to work closely with us in this endeavor. I'm going to turn it over to Dr. Huang in a moment to explain to you the decision-making process and his decision to delay in-person opening of schools. A decision that is not an easy one, but one that I and the vast majority of people that we have spoken to today agree with. I want to commend Dr. Huang for being very collaborative in this very brief time that we've had this power with our Dallas County Health and Human Services, less than 24 hours, in fact. He's talked to a lot of people, and I want to pledge to you that we're going to be even more collaborative in the future. I've reached out to teacher groups and principals and other groups, and we want to hear from everyone, because this is not a one-time decision. There will have to be decisions made. Unfortunately, with the situation that we have here in Texas, there'll be many decisions to be made as far as what is in the best interest of our kids. We have put together a committee. The committee is yet to meet, but the committee will be chaired by an eminent child psychologist. We recognize this is more than just keeping teachers and students physically safe, that the COVID is taking an emotional and psychological toll on your kids, that there's a challenge with nutrition, safety. There are special populations, special needs, and other populations that must be thought about, and I pledge to you, we will spend hours a day working to make sure all those populations have the best outcome that they can have. Here's Dr. Huang to explain to you the decision-making thus far and where we are.
Good evening. As we always start these things, we are today announced 1,027 new cases, so we've got 37,996 reported. We've had reported 16 new deaths today, which is tied for the third highest number in a single day of deaths that we've reported. And it's in that context, really, that we've been looking at this issue. We've seen record numbers of emergency department visits, hospitalizations, ICU admissions in Dallas County over the last week or so. So, given these numbers, it's really imperative that we do what's best for the safety of our school children and our school employees. This afternoon, as the judge mentioned, we actually had a Zoom call with almost all of the superintendents of all the public, private, and charter schools across the county to discuss students returning to campuses for in-classroom learning. We discussed in depth, really, the challenges that schools are currently facing. Many expressed concerns about reopening their classrooms for in-person instruction and the safety of teachers and staff and students. So I'm issuing this public health order today that delays in-person instruction for all local public and private schools until September 8th, 2020. Now, this order allows schools to begin remote instruction on schedule, but it does also ban all school-sponsored events and activities, such as clubs and sports, until the school systems resume in-person instruction. Also, the order includes a provision that 2 weeks before beginning in-person instruction, schools must share their reopening safety plans with parents and the public before at least 2 weeks before in-person instruction begins. So I think those are the main things about this. Again, as the judge mentioned, there are a lot of different issues related that we recognize. It's a hard decision. We heard the comments from the superintendents and took them to heart, but we feel that this is what's best for the safety of our children and staff in schools at the present time.